I'm Jill Kreisky. I'm the Associate Director of the Southwest Pennsylvania Environmental Health Project. I appreciate the promotion, but I'm not the director. The director is Raina Ripple, couldn't be here today. Let me get my PowerPoint set up. So, again, delighted to be here. Always delighted to be back in West Virginia. Before I came here to Wheeling, I was in Morgantown at West Virginia University for a number of years as well, and always happy to be here. Okay, good. So, again, our organization is the Southwest Pennsylvania Environmental Health Project. We have a table of information back there. We'll be there at least for a good part of the day, and I encourage you to come by and get materials. Our mission is really to help people get timely, trusted, and accurate information about shale gas development. And also, because our focus is on health issues, we do what we can to provide materials and guidance about what to do if you're having health impacts. It's a nonprofit organization. We've been around about 7 years, and we are in Southwest Pennsylvania. We're in Washington County, which in Pennsylvania is sort of the bullseye for shale gas development. But we do work all throughout Southwest Pennsylvania. We've also done work in West Virginia and Ohio and some other states around the country. So we stretch out as far as the resources will take us. So the kind of things we do, we started out thinking, well, we'll just help assess people's health issues and then send them to healthcare providers that can help them with those issues, and case closed, right? But what we learned when we started is that nobody really understood what the health impacts of shale gas development were. And so we spent a lot of time helping people monitor their air, especially, and a little bit on water monitoring, then helping them with an analysis of that data, and then trying to figure out the relationship between the emissions and health impacts. And so we spend a lot of time still with monitoring and also with developing tools that you can use to see what these relationships are. And I encourage it, again, go to the table back there, but our website has many more materials and online tools you can use. So I skipped right over the title of this presentation, but let me give you a little outline of what I'll do. The title you'll see is the externalized cost of pollution, and if it sounds like economic speak, it is. So I gave it a subtitle, which is really, who's really paying for shale gas development in the Ohio Valley? And Kathy Hipple did a great job of talking about the economics of this industry, but there are economics beyond that we have a hard time talking about because they haven't been particularly well measured. So I'm going to try to make 3 points, and I always try to map it out at the beginning in case I wander away. You can pull me back. There are community members out there that are bearing costs, and their health costs related to shale gas development, and the industry isn't paying for that. It's an output of the industry. It's bad health in some places, but they're not paying. So we're going to look a little bit at what the health impacts are, and then talk briefly about if they can be measured. And then beyond the physical health impacts, there are also indirect impacts, some mental health and community impacts that, again, the industry is creating, but they're not paying for. And that kind of brings us into a discussion of what really determines your health. And so we'll talk a little bit about something called social determinants of health. And then finally, we don't know a lot about these costs that are generated in these ways. And so we'll kind of go through a little list of what some of those costs are, also what some of the benefits are that aren't measured, and then I'll have a quick concluding thought. So just from the start, I want to say that when we talk about fracking, we mean all the stages of fracking. So, when we started, fracking was, sticking the pipe underground and getting the gas to come up. But in fact, it's more than that. It's the trucks that carry the materials to the site, it's the flaring, it's the ponds that they keep the water in and the flow back, and pipelines. Many of you aren't near a fracking site maybe, but you're almost certainly near a pipeline. So we're talking about all stages, and we talk about all stages because there are emissions from all stages, and when there are emissions, there are potential health impacts. So this is a handout, and we have a bunch of them on the table back there, and I really encourage you to pick that one up because it's the simplest description, really, of how come there are health impacts. And basically, the process requires shooting a lot of chemicals and water underground. It means that that water comes up, typically with some other stuff that it brings up from underground, which can include radioactive materials. Then when it comes up, we have emissions that come out from into the air, the water, and the soil. Who's impacted by that process? Well, anyone who is around, the factors that determine how impacted you are is the duration of time you're exposed, the frequency you're exposed, the toxicity of what you're exposed to, the distance you are from the source of the pollution, and then, of course, especially who you are. And if you're in a class we would call a vulnerable population, you're more susceptible to impacts from those things. There's short-term impacts, and we'll talk a bit more about those, and long-term impacts. And in fact, we don't really even know what all the long-term impacts are at this point, because this is a process in this region that's been going on a little more than 10 years in a big way. And so we don't really know what kind of cancers and things potentially could come out of this. So I just want to put this up here. This it's a little light, I think, but who's the most impacted according to the research that has been done? And it's pregnant women and their babies, very young children, and then adults who have high exposures. Preterm births, low birth weight are some big issues that are being raised. There are some congenital heart impacts. And then for adults, eyes, throat, nose, cardiovascular problems, respiratory problems, and probably cancer-related hospitalizations. And all of this is refereed research. So people in research universities are following very strict research protocols. They write up papers, other experts in the field review those papers, and they get published. This isn't just EHP saying, well, that's what we see in the community. And there's an increasing amount of information on this. This is our data, which confirms what the researchers are finding. And we collect our data from people who take a health survey from us because they think they're having symptoms. And this is what we're finding with our survey, is that more than half of the people, if you look at the second column, that's a percent, more than half people who come to us and fill out the survey have upper respiratory symptoms, what we call constitutional symptoms, so they don't sleep well, fatigue, they're weak or drowsy, neurological symptoms, and psychological symptoms. More than half of the people we see have those kind of symptoms, and then the others down the line. So, all those studies are good. They're showing an association between shale gas development and health. What they're not saying is, what's this cost? And and even if you could put a dollar amount on it, what we know is that not everybody is accessing the healthcare system, right? I mean, people are probably having these symptoms and not going to the doctor because the symptoms are just worsening of some general symptoms we all have. Doctors are not saying, yep, you've got this, sinusitis because of shale gas. They're not even asking those questions, so they're not diagnosing that these illnesses are a result of this process. And medical records are not really accessible to most researchers. There are a few that have been able to tap into that. So we don't have a good measure of what the problem is, and so we don't know what the cost is, but we know that except in some very, very unusual circumstances, the industry isn't paying any of it. There are a few cases, or some cases, we don't even know how many, honestly, where industry agrees to a settlement with a family whose health has been impacted, and they make them sign what's called a non-disclosure agreement, so they don't end up talking about how much money they get. There are mental health impacts. Environmental pollution comes in a lot of forms. A quick example, noise. If you have a lot of noise, it leaves you fatigued because you can't sleep. It worsens your ability to concentrate. And just think about the kids that live near fracking. Again, the kids that are living near this and then try to go to school and concentrate. Psychological stress, there's the emotional stress, and any of you who have fracking in your community know these things. People are frustrated, they're sad, they move there because they wanted to be in a rural, quiet community, and that's not what they have. And then also anxiety, panic attacks, a sense of not being in control when this descends on your community. We do have a handout about this too, and it's in the back as well. And again, an increasing amount of research saying, these mental health impacts are real, and again, who's bearing the cost? So what are people anxious and stressed and depressed about? The uncertainties of fracking. You try to talk to the industry officials and you get nowhere. The noise and light pollution. You're worried about if you're going to get sick or your kid's going to get sick. You think about the possibilities of having to move, and you think, we can't afford to move, or we don't want to move. We've been here for 6 generations, right? So these are all what contribute to mental health concerns. And you might think, well, worrying about your property, is that really a health concern? Well, depends on how you define health. And in fact, the World Health Organization defines health very broadly. It's not just physical health, it's physical, mental, social well-being. It's not just not having a disease. And this is a definition that really has been accepted worldwide. And what it focuses on are all the things that feed into community health. The things at the top, whether or not you eat right and exercise, or whether or not you smoke, if you get care from a doctor, or just the genes you're born with, those all contribute to our health. But down here at the bottom, 55% of our health is dependent on what we call social and economic factors. And, well, what does that mean? More specifically, what kind of care do you get early in your life? Those first few years are so fundamental. Education, do you have a job, a steady job? Do you do work that's fulfilling? Do you have enough food all the time? Do you have quality health services? What's your housing status? Do you have decent housing? Is it secure housing? How much income do you have? And do you have social support? Do you suffer discrimination? All those things are very closely associated with good health. And those are things, if you think about what the shale gas industry is doing, it's kind of negative on most of those fronts. But in fairness, I'll say, admit that there are some positives. Jobs, that's what we hear all the time, right? There are jobs. But as Kathy pointed out in her first presentation, that's way overestimated probably. Income from leases, there are clearly people in our community benefiting from income from leases. But not everybody, just because you own land doesn't mean you own the mineral rights. And so it is not always the people living in the community who benefit financially there. Industry has been generous in some communities, donating to libraries and Little League. But if they're voluntarily giving it, can they also voluntarily take it away? It's nothing we can depend on. In in Pennsylvania, we don't collect a severance tax like you do here in West Virginia and Ohio, but they collect what they call fees so that they're not taxes. But that red section there tells you how they distribute it. A lot of it goes to state agencies right off the top. Then 60% of what's left after that goes to the counties with shale gas drilling, which I think is 24 to 28. And then 40% is distributed across all 66 counties in the state. And is that going to be enough money to make up for other problems that are being caused by the industry? Typically not. On the other side, the negative impacts that a lot of people see that again are associated with the social determinants, increasing rates of crime, alcohol and drug abuse, and some of this seems to be associated with young single workers coming from out of town without much to do except work, and then these sort of social problems crop up. There are also indications in some communities that domestic violence is increasing, sexually transmitted diseases, and are the living conditions of the workers and the families contributing to this, or to the permanent residents. There's a big issue with housing, especially in rural areas. Low-income residents being pushed out of their housing because landlords realize that they can make more money renting to these people that work for the gas industry that are making a lot of money. People whose house is right near a well. Your house is your biggest asset, right? And what's its value when there's this pollution spewing well next to your house? There's some indication in some communities that mental health and social service caseloads are going up, but the communities aren't getting more resources to help people out with those. And then finally, the issue that I think we all know about, which are the roads, right? The roads in West Virginia, Ohio, Pennsylvania, they're not set up for industrial use in most cases. But those are the roads we use to get to work every day. And are these compatible uses? But there's a researcher out of Johns Hopkins University in Maryland, Brian Schwartz, and I would encourage you, if you're interested in looking at literature on health impacts, he and his research group have done a lot of it. But this is something he and somebody did very early on. They looked at shale gas development in communities with high levels of community socioeconomic deprivation. And socioeconomic deprivation are all those sorts of negatives that have come with shale gas. And this CSD is associated with a lot of sort of chronic health conditions: diabetes, obesity, asthma, heart disease, mental health problems, destructive health behaviors. And so, unfortunately, their conclusion was this: degradation, deprivation, and unhealthy individuals are possible long-lasting legacies in communities with extensive gas drilling. So I think the conclusion, or my final question is this a price too high for us to pay when we live in and around these shale regions for the development of gas? And that's a question that should be raised every time a new facility is proposed. What's the cost external to the industry going to be?